Often parents are confused about what kind of physical activity is required for the children and where to start. So I get a lot of questions on these too. So let's talk a bit about physical activity in children. As we all know, children are by default more active than adults. However, in recent times, because of our lifestyle, lack of access to go and play outdoors, and increased time spent with screens has limited the natural ability of children to move around and stay physically active. So how can we ensure that the children get the right amount of physical activity? So coming to what is the right amount of physical activity? So it is recommended by experts that children should have at least 60 minutes, that is 1 hour of moderate to vigorous physical activity in a single day. So what do we mean by 60 minutes? So this 60 minutes can be at a stretch, that is complete 1 hour, or it could be multiple smaller units of time which can ultimately add up to 60 minutes in a day. So what kind of physical activity can children do? So apart from normal play, children can get these 60 minutes in the form of exercising through a structured sport, or it could also be just running, jogging, or walking around. So what kind of exercise is recommended? So it is recommended that they do moderate to vigorous physical activity. So what do we mean by this? So moderate to vigorous physical activity means that with the type of physical activity, there is an increase in heart rate and there is also an increased effort in breathing. So out of this, vigorous activity is a little more intense, and it is recommended that children do these at least for 20 minutes each day or 60 minutes at a time, at least 3 days in a week. Exercise can also be divided into 3 different types. There is something called aerobic exercise. There are some things called muscle strengthening exercises and bone strengthening exercises. It is recommended that children do a variety of activities which involve all these 3 types of exercises for a healthy life. So what are aerobic exercises? Aerobic exercises are those where children rhythmically move their bodies with large muscle groups for a sustained amount of time. So aerobic exercises are very important for cardiorespiratory fitness, and they are the ones which will increase the heart rate and also the breathing effort. So what are some examples of aerobic exercises? It includes running, skipping, jogging, brisk walking, and swimming, dancing, and many others. What is most important is the child does an activity which is enjoyable and the child can sustain it. So coming to muscle strengthening activities. So muscle strengthening activities are those kind of activities which will put a little bit of more load on the concerned muscle than what they normally do in being physically active. So muscle strengthening activities could include unstructured play in the form of climbing a rope or climbing trees or playing tug of war or anything which is part of routine play, including using playground equipment to play. And in older children, it may be more structured, like lifting weights, using body weight itself, such as doing pull-ups, push-ups, or even some forms of yogasanas. So coming to bone strengthening exercises, what are these? So bone strengthening exercises are those activities which will help strengthen and make the bones stronger. So these are some activities which happen because of weight bearing and because of impact with the ground. So many of the activities such as running, skipping, and hopping, although are aerobic as well as muscle strengthening, also contribute to bone strength. Any activity, including sports such as tennis, badminton, football, where children are running side to side, can also put weight on the bones and help the bones become stronger. At Aster RV Hospital, we are starting Fit Kids and Teens Comprehensive Healthy Weight Clinic, which is a new initiative. The clinic is going to be launched on the 18th of August, and we are going to run the clinic on the first and third Fridays of every month between 3 p.m. to 6 p.m. So in this clinic, you will get to meet all the experts, including a pediatric endocrinologist, a pediatrician, and a pediatric nutritionist, all under one roof. Here, the child will be assessed comprehensively and a customized plan will be provided based on the assessment made. At the Healthy Weight Clinic, we are not only going to be managing kids who come with obesity, but we will also be addressing concerns of children who are underweight, who are born small or low birth weight and premature and who are having difficulty in catching up growth, children who are picky eaters, children in whom the parents are out of ideas to feed them with healthy meals. So here we will be providing growth assessment, dietary assessment, as well as a customized meal and physical activity plan.